Join us now for Health for Life, brought to you by Hamilton Healthcare System. Today we're talking with Dr. Arif Ali of Peeples Cancer Institute in Dalton. Thank you so much for joining us today, Dr. Ali.
Yeah, thanks for having me. Excited to talk about what we do over at Peeples Cancer Institute.
Well, it's an exciting place, and I can't wait to get into that. I want to introduce you to everyone. Dr. Ali is a board-certified radiation oncologist. Peeples Cancer Institute, located at 1215 Memorial Drive on the campus of Hamilton Medical Center in Dalton, Georgia. Dr. Ali, let's talk about female cancer.
So female cancers, or, specifically gynecologic cancers, there's quite a few different types. So there's cervical cancer, there's endometrial cancer, there's ovarian cancer, and, plenty of vulvar, vaginal. So quite a few different types of cancers out there. For most of the cancers, the treatment is some combination of surgery, chemotherapy, and radiation.
Okay, or all three sometimes?
Correct, all three. Sometimes we might just do one or the other, and for a lot of cases, we end up doing all three, though.
I understand. And at Peeples Cancer Institute in Dalton, Georgia, you guys know a lot about the gynecological cancers.
Yes, we are fully equipped to handle the radiation and the chemotherapy portion of the treatment for gynecologic malignancies. The ones that we think of most, just kind of zeroing in on the radiation aspect, the ones that we think of most that benefit from radiation would be sort of cervical cancer. Endometrial cancer, typically patients will have surgery, and then in certain instances we can do some radiation, or we need to do radiation to that afterwards. Occasionally there's chemotherapy thrown in the mix. Again, vulvar, vaginal cancers, there's a radiation component to it all. So we're very well, equipped to provide the radiation and chemotherapy aspects of treatment for these gynecologic malignancies at PCI. And so no matter where a patient ends up getting their surgery for their gynecologic malignancies, the key point is that we can provide the radiation and the chemotherapy aspects right in our backyard here in Northwest Georgia.
Well, let's talk about brachytherapy. And tell me, a lot of our listeners, they do not even know, including myself, I don't know what brachytherapy is. But brachytherapy, I understand, is something that's important and used in female cancers. First, what is brachytherapy and how is that used?
Yeah, so it's not a lot of people have heard of it. Even, most physicians, I would venture to say, have not really heard of brachytherapy, but it's a unique type of radiation therapy. So when people typically think about radiation therapy, they think about external beam radiation therapy, where you have this giant machine that produces high energy X-rays. It goes out of the machine, into the body, into the tumor. And so that's most of what we do. Brachytherapy, instead of from the outside into the body, we have the radiation that is essentially goes from the inside out. So we're able to put very, very high doses of radiation right into the middle of the tumor, and then it sort of emanates from the center of the tumor outwards. We have some technology available to us that allow us to adjust the dose and conform the shape to really match the tumor very well, so that we get a high dose of radiation to the tumor and a very small dose of radiation to surrounding organs. So brachytherapy, in essence, I would think of it as internal radiation.
Internal radiation. Now, when you talk about external radiation, or what I think of radiation, to get to that tumor, you've got to go from the outside. So are you also damaging other things getting there?
We typically adjust the dose so that there's not damage per se, but there can be some side effects. You can get some irritation, the bladder, irritation of the rectum. And that's because you have to go from the outside through the rectum, through the bladder, into the tumor.
But with the brachytherapy, that's totally different.
Correct. So brachytherapy, we are able to provide radiation right inside that tumor, and then it starts in the tumor, and then it goes outwards from there on. And depending on the dose and the intensity, we're able to adjust that so that we get fairly limited doses to the rectum and to the bladder and other surrounding structures. So for gynecologic malignancies, some of the times we can do just brachytherapy. For instance, some very early stage endometrial cancers. For things like cervical cancer or other cancers, it really requires a combination of external beam and brachytherapy. So external beam radiation and internal radiation.
Now, this has been around a while. Why do you think a lot of doctors have never heard of brachytherapy?
It's definitely something unique to radiation oncology. It has been around for a while. The brachytherapy is a little bit more involved than external beam in the sense that patients have to go to the operating room. So if we're treating cervical cancer, we would do anywhere between 5 or 6 weeks of external beam radiation, daily radiation. Then we would treat whatever residual cancer is in the cervix with brachytherapy. And so that involves involves going to the operating room for, maybe about 4 or 5 times. But the patients go to the OR. We insert this radioactive source and apparatus. We deliver the radiation, pull the radiation out, pull the devices out. Patient walks out the front door, usually, outpatient that day, without any sort of radioactive sources inside their body. And so they'll just do that 4 or 5 times typically. It is, involved. It does require some expertise for sure.
And at PCI in Dalton, the expertise is there.
Yeah, so we're very fortunate as part of our physician group. We have one of the physicians, Dr. Ellis Ziel, Z-I-E-L, has done an extra year fellowship specifically in brachytherapy at the University of California. So most of us, for most radiation oncologists, do about 5 years of training. And as part of that training, we become very, very proficient at brachytherapy. We're all comfortable with it after the 5 years, but he's done an extra year of training specifically in brachytherapy after the 5 years that all of us do.
Well, now, when you're talking about him taking that extra year, are there a lot of doctors who have done that across Georgia, or do you think it's a very small number?
I know a lot of the doctors in Georgia, and I can only think of 3 radiation oncologists that have done an extra year of training specifically in brachytherapy, and he is one of the 3. There may be others, but it is a very, very small number of people that have that expertise.
Dr. Ali, let's talk about how important screening is.
The screening that we do for all cancers in general has had a profound impact on treatment. It is any sort of cancer. It is much better to catch it early than late. The earlier that we can catch it, the higher the chances are that we can cure it. And so, for things like gynecologic malignancies specifically, cervical cancer, endometrial cancer, it's important that patients regularly follow up with their gynecologists. Their gynecologists are going to be experts at screening for these various types of cancers. And again, it is so much better to catch it early when we can treat it than to catch it later when it may not be treatable or curable at all.
Wow. And regardless of where you get your screening, right here in Dalton, Georgia, at PCI, you guys can take care of radiation therapy, anything that needs to be done.
That's right. And so, local gynecologists will do the screening for a lot of the gynecologic malignancies, and they may do a biopsy, they may do a diagnosis. And the bottom line is occasionally surgery is required, and no matter where that happens, for many of these cancers, chemotherapy and radiation therapy is also required. And so we're very happy and proud to be able to provide everything that is needed from a chemotherapy and a radiation aspect for the treatment of gynecologic malignancies right here in Northwest Georgia at PCI.
Well, that's wonderful. PCI right here in our own backyard.
That's right.
Dr. Ali, choosing a cancer treatment center is so important. That accreditation needs to be there, correct?
Yes, getting cancer is a huge, huge shock for everyone, family, for the patients themselves, and many times patients will hear that diagnosis and, they just want to get treatment started, whatever that takes. It really is important to do a little bit of homework on the place that actually provides the treatment. There are differences in capabilities as well as expertise and experience in the treatment of a lot of cancers. And so patients and families could, do their research themselves and spend hours and hours and hours and the internet and everywhere else trying to find out the right cancer center. But there are organizations that have done the homework for them. Accrediting organizations like the American College of Surgeons is one such accrediting organization. And it is important to find a center that has been accredited by the American College of Surgeons. This provides at least a basic fundamental level of capability and expertise and resources to effectively treat cancers. And so I'm happy to say that the Peeples Cancer Institute is fully accredited by the American College of Surgeons. And so we, of course, are happy to provide a plethora of treatments and resources for cancer patients here in Northwest Georgia.
Dr. Ali, thank you so much for this great information. If you could leave our listeners with one word of advice about their health, what would that be?
Well, so I'm a radiation oncologist, and so I'm actively involved in the treatment of cancer. But honestly, the most important thing is to not get cancer at all. And so I would highly encourage patients to really eat right, eat healthy, exercise, do everything you need to do to sort of minimize the chances of cancer. Get regular screening with primary care physicians, gynecologists, so that if you do get it, we catch it early and we can treat it and cure it.
Wonderful. Thank you. For more information or an appointment at Peeples Cancer Institute, call 844-PCI-HOPE. This program in no way seeks to diagnose or treat illness or to replace professional medical care. Please see your healthcare provider if you have a health problem. Thank you for listening to Health for Life, a presentation of Hamilton Healthcare System.